I'm a GP. I've worked at West Cornwall Hospital in the urgent care centre for the last 2 years, and the last 18 months I've been the medical director for the whole of the hospital as well. It's a fairly small hospital, but has a large geographic area that we cover, and up to about 200,000 patients. And we work very closely with the local GPs and with the ambulance service. We're obviously working outside normal GP hours, so we really felt that for patient safety it would really help us to be able to access details of those patients when they came in. In terms of what I like about Guru, it was for a start, it's used by most of our local GP practices, so that gave us good coverage of most of the local patients in the area. We were able to do the training online or face-to-face, so they were very flexible like that. So they're a can-do service. It was very simple to learn and actually very, very intuitive in how you could access the details of the patients, their allergies, their drugs. So, in terms of how easy to interface with a hospital system, it was very simple. Well, in terms of patient care, one of the most difficult bits with unscheduled care is that they're not planning to go to see someone. Something happens and they're brought into us, often by ambulance, and it's the sickest patients that often are the ones that benefit the most. So they're actually in a difficult place. They sometimes forget to tell us all about their history. They don't know their medications. They'll tell me that they're on a red and yellow capsule. I might know that's amoxicillin, but some of the more obscure ones, actually it's much more difficult to guess what medication they're on. And they don't always tell us about their allergies, so it just means that we've got a much more complete picture for managing their care. Certainly Guru I would recommend to others. It's a very simple system, it's easy to train on, it does what it says on the tin really. As a GP in a practice that was very strongly linked and beta tested software for microtest, and knowing the senior members of the team relatively well, I think they're a very good system, and they're very responsive, so it's easy to get help as and when you need it.